I'm Ola Hill. I'm the Deputy Organisational Resilience Manager for the CCG across BLMK.
What was your role during the COVID-19 pandemic?
So that's very interesting. So I joined the CCG literally the day after lockdown 1. So the first lockdown was 23rd of March 2020. I joined the CCG on the 24th of March. And I'd originally joined as the Risk and Governance Manager for Bedfordshire CCG. But because I came from an emergency planning background, I was redeployed into the EPRR team. That's the Emergency Preparedness, Resilience and Response team under Mark Meekins. So I was redeployed into that team because of my emergency planning experience, and really had no opportunity to learn, so hit the ground running from the start. I was embedded within the comms cell. At the time, we'd broken the whole CCG down into cells. So I was embedded into the comms cell, and I was the EPR support for the comms cell. And I was also part of the ICC, which is the Incident Coordination Control, Coordination Center. So I was part of that, and really just got stuck in with supporting the organization to respond with comms. It was really about managing the messaging and the warning and informing of not just staff, but of the public. And then during the first wave of the pandemic, I led on the deployment of PPE. So that was quite a challenge for BLMK right at the outset of the pandemic, with restricted access to PPE across all of our services. So I led and facilitated that with support of some fantastic colleagues. Worked with multi-agency partners, local authority, fire, ambulance, police, as part of the local resilience forum. So that's the LRF. And BLMK actually sits within 2 LRFs. So we have Bedfordshire LRF for Bedfordshire and Luton, and Thames Valley for Milton Keynes. So working across those 2 areas and the challenges that brought along with it. And then into the second wave of COVID, supported with really led on testing, especially around testing for key workers. So we deployed, obviously prior to me coming on board, there was the amazing swab squad that was championed by Bernie Harrison, and that was a really, really awesome piece of work. So my role was really just taking that and rolling that out a little bit wider, supporting key workers from across BLMK to access that testing as we really got into the nitty-gritty of the pandemic, so to speak. So we ran that out of not just Steppingley Hospital, but across a number of sites and facilities, and worked with the Department of Health to deploy mobile testing units across our patch to support local authorities to help community get tested. That was really interesting. And then into the third wave, which we're sort of coming out of now, so to speak. I've supported with the vaccination deployment program, and just really helped with the infrastructure around all of that, and working with the region and partners such as HCT, Hertfordshire Community Trust, to deliver vaccinations out of our vaccination centres across BLMK. So I've had an interesting experience throughout COVID. It's been varied, I think, in terms of what my contribution has been. I think one word that I used to describe myself in terms of COVID, and probably in terms of most things, is flexible. I like to think of my response and the way that I work as just being open to change and to be able to flex. So throughout COVID, we formed the Organisational Resilience team, headed by Mark Meekins, and we we now hold portfolio for risk as well as emergency planning. And so that's been really critical as we've gone through COVID in bringing together all the business as usual stuff around risk management, actually more into an emergency preparedness sort of focus, because what we tend not to do is we tend not to think about business as usual things in terms of what happens if it all goes wrong. And EPRR is a lot about what do we do when things go wrong. And it feels a little bit like we've been doing that for the last 18, 20 months. So we've gotten to a point where through COVID, we've been able to bring the best of both worlds into developing a system that supports not just the CCG, but the wider BLMK community as well.
Was there anything in particular that you learned from the experiences you had?
Anything in particular that I learned from the experience? Actually, I think for me on a personal level, if I start there, is that the human spirit is extremely resilient, and NHS colleagues are amazing people. So because I joined right at the outset and I joined in a remote working environment, it was tricky trying to learn the lay of the land and understand people and departments and directorates and all the rest of it while working in a remote environment. But people really just galvanized and came together. I never felt as though I was the new kid on the block at any point. And one of the things that's really, really stood out, both on personal and on a professional level, is really about partnership working, and how really if we focus on working together, we get things done far more quickly, we get things done far more effectively. And that's really, really stood out for me as we've gone through COVID as one of the hallmarks of sort of 2020-21 that I hope we can keep as we go forward. I think for me as an individual, I feel like I've grown up by like 5 years as we've gone through this, because of just the amount of things that I've gotten the opportunity to do, which had it not happened, I wouldn't have had the opportunity to do. So for my own personal development, I've learned an awful loads. And it's just been a really, it sounds weird and crazy to say, but it's been an amazing time to be in the NHS. And I think that colleagues will probably reflect when we come out of the back end of this on how much they've grown as individuals. I know that I certainly have.
You are considered to be one of our COVID-19 leaders. If you could give one piece of advice to someone wanting to be seen as a leader within the NHS, what would it be?
I'm not sure why I'm seen as a COVID-19 leader, to be honest. I think it's about mucking in and really being very genuine. I think people respect people that are genuine. I think that people are inspired by compassion. I'd like to think that one of the things that I've developed all the more as we've gone through the pandemic is compassion, not just compassion in terms of patient care. I'm not a clinician by background, so not necessarily in that sense, but compassion for colleagues, compassion for oneself. And I think that if there's anybody thinking of, wanting to develop in their career, wanting to become a leader, is that leadership is at every level of the organization. You don't have to be a senior manager to be seen as a leader. Anyone that can be trusted to get things done and can be entrusted to inspire people and to support colleagues is considered a leader in my view. And I think that if you are compassionate, if you are genuine, if you are willing to put your best foot forward and be flexible and responsive, I think you can count yourself as a leader in my book. I think for senior management and for senior leadership, it is about putting oneself out there a little bit and being vulnerable a little bit. And I think that as we've gone through the pandemic, a lot of leaders have been vulnerable. A lot of leaders have shared personal experiences. That makes us relatable as leaders, if I can say that. And it makes people want to support you to do a better job because they can relate to you. So being accessible, being visible, being vulnerable, I think makes one a better leader. But honestly, I think leadership is at every level. I think that if you have a drive and you want to inspire people, you want to bring change, you want to do better, then people will follow you. It doesn't matter what level of the organization you're in. People will follow you. People will be inspired by you. I'm inspired by my team all the time, and I count them as leaders as well.